Monk, whenever you are ready, go ahead and take us through your presentation. Thank you.
Thank you so much. Yes, thanks everyone for taking the time today. Good morning and good afternoon to everyone. Hopefully, no matter what your lens is on wellness, whether you're a student, employee, faculty, this is of value to you, and it can kind of help you understand a little bit more how to take advantage of some different wellness initiatives. All right, so today we're going to look at how wellness can provide value to healthcare organizations, students, employees, and employers. So trying to focus on multiple lenses here. And so I want to focus on increasing some understanding of policy outcomes, parameters of wellness programs, some of the wellness measures, really focusing in on costs and health outcomes, the role of healthcare organizations, employers, students, and employees, and then some suggested research framework. So first of all, we need to start with what exactly are value-based wellness programs. So this actually goes back to the Center for Medicaid and Medicare. They have some different programs in place, and their overall goal is to link provider performance to quality measures and then back to provider payment. And this is all part of a larger quality strategy. CMS has a three-part aim: better care for individuals, better health for populations, and lower costs. And when we think through wellness, then we want to define exactly what that means. So as many of you know, there is a lot of research here. It's what I'm passionate about and what I enjoy researching. So I pulled up this model here that really breaks down wellness into 6 main categories of everyone's life: occupational, physical, social, intellectual, spiritual, and emotional. So a lot of different areas are touched on. And now going into what exactly is a wellness program. So a wellness program is intended to improve and promote health and fitness, and it's usually offered through a workplace. Now insurance plans sometimes offer it. Sometimes students can obtain health insurance and therefore can have access to a wellness program through the university as well. It allows an employer or plan then to offer some different discounts. You might have cash rewards, gym memberships, incentives to participate. Some of these examples a little bit more specifically might be a stop smoking program, diabetes management, weight loss programs, and different preventive health screenings. And going back to CMS's program, they had 5 original value-based programs: end-stage renal disease quality incentive program, hospital value-based purchasing program, hospital readmission reduction, a value modifier, and a hospital-acquired condition reduction. Now they went on to go ahead and add a couple more programs, which include skilled nursing facility and home health value-based program. So as you can see, wellness is not included yet on this. So that's part of the reason why we need more research, more measures, so we know how to perhaps encourage this sort of initiative moving forward. So now I wanted to take a little time out. I really appreciate many of you participating within the comments. Some of you kind of already answered this, but maybe in the chat, I'm not sure if folks can unmute themselves, but what is the most supportive and helpful to you and your family when it comes to these wellness programs? So hopefully everybody's awake and we can see if I can look at some chat if anybody wants to participate. I can start with some examples. When it came to the commons, some comments were shared about how, better access to primary care physicians, also allowing time not only for primary care, but those referrals that you might receive from your primary care. So let me see if I can figure out if we have any chat going on here. It looks like maybe we don't have any participants at this point.
There are a couple of items in the chat, not in the Q&A pod.
Okay.
Have sponsored memberships to gym, mental health needs should be included in wellness.
Nice.
Periodic coaching. Agreement with all of those things, and mobile access to information.
Excellent. I love those ideas. Absolutely. More and more information is coming out and more research is coming out about mental health. And of course, sometimes that is kind of reactive to some epidemics that we definitely have going on. So excellent points there. Maybe I just have to learn how to get to them.
There is a follow-up question of, is there any AI involvement at this time?
I'm sorry, what was that? What kind of involvement?
AI, artificial intelligence involvement at this time?
Oh, that's something that I should look into. There's certainly, I know that there's a lot of different initiatives to become more innovative, but that's something I will look into and post on the comments. I will go ahead and note that down so that I remember. All right. Well, thank you everyone for your participation. Glad to know that people are out there listening. All right, so we'll move on here. And now I want to shift gears a little bit to the delivery of wellness programs. So what is actually happening? So in a 2018 survey from the National Business Group on Health and Fidelity Investments, it found that 86% of employers offer financial incentives in their wellness programs, and this is an increase since 2017 of 11%. And employers also increased incentives, somewhat substantially from about 742 per year in 2017 to 784 in 2018. And we know that this is a trend. The workplace wellness industry has more than tripled its annual revenues to $8 billion in recent years. And now wellness programs cover more than 50 million American workers. And again, this is expected to continue. About 67% of employers plan to extend their wellness programs. So you'll be glad to hear that this does include mental health, more focus on emotional health, and a continuation on physical health, but just increasing and expanding those offerings. So as some of you may have participated in, a lot of wellness programs do include clinical and biometric screenings. So these are really generally looking for common risk factors. So they'll include measures of blood pressure, weight, resting heart rate, blood glucose levels, and cholesterol. So there's different ways. Some employers might actually have these screenings offered and opened with nurses ready to take these measures. Other employers have their employees get these measures from their primary care physicians and then report them. There are also risk assessments to, again, identify these common and mostly what we're looking for are modifiable risk factors. And this way, it's a little bit of a gateway then, so employers can understand what kind of support and what kind of referrals are most helpful to offer. And there's 5 main components that have been identified in most of these wellness programs. Of course, you need your communication strategy, both on the healthcare side, the employee side, the employer. So everybody knows what's available and what's going on. There's an opportunity for employees to engage. So offering some time maybe to be able to go and get assessments or engage in a program, having leadership engaged so that it starts to become more of a cultural thing and it is accepted, the use of existing relationships. So I have in here to be able to leverage with your health plan provider, but this might also be trying to link to different community resources. And then, of course, a continued evaluation so that we know if what we're doing is working. All right, so there are several implications from the Affordable Care Act. This is a lot of the reason why we have seen the major increase in wellness programs. One of the things that the ACA did was allow initiatives under wellness programs to increase from 20% to 30% of the cost of coverage back in 2017. The average amount of results-based initiatives to 10%. And sometimes it can even be up to 50% of the cost of coverage. And a lot of times this is with stop smoking programs so far. Because of some of the different policies and lawsuits actually that occurred, we need to be careful about all of these. All of the information that is received through a wellness program needs to be used. So 80% of employers use results from program planning and evaluation for trying to understand the best prevention interventions to include. And as you'll see from these lawsuits, we will summarize here that, although there's a lot of encouragement of these wellness programs, they never supersede anything from the Genetic Information Non-Discrimination Act or the American with Disabilities Act. All right. And other things that we cannot supersede include the Health Insurance Portability and Accountability Act, HIPAA, as we refer to it. It does allow some flexibility. And again, in the ways that we've seen it and were listed before, so with discounts, waivers of cost sharing requirements, and improved benefits. And there was also a focus from the ACA to really focus on 45 recommended preventive services that must be covered without cost sharing. All right, so now we're going to talk about some of the challenges that occurred in trying to increase these wellness programs. Here we have an energy company who had an employee refuse to take a health risk assessment, which was part of the wellness program. This employee had concerns about the confidentiality of the results. The penalty then for not participating was payment of the entire premium of her health insurance, which meant $413 a month plus a $50 non-participation penalty. This employee also tried to persuade others, and it actually led to her termination, unfortunately. So the U.S. Equal Opportunity Commission then came back and said, this is too steep of a penalty. You can't really even consider this program voluntary because it is so steep in what they're using as their attempts at including more employees in the program. But this was not actually illegal. But what was the medical inquiries were not job related, and they were not part of a voluntary wellness program. Here we have another company. This company threatened insurance cancellation if an employee did not submit to medical testing and assessment. It required employees to undergo biometric testing and a health risk assessment or face the cancellation of their medical insurance or requirement to pay the full premium. And finally, we have Honeywell. I think this was kind of the most broadly, you might remember this being in the media. But employees were penalized if their spouses did not take part in the biometric tests. And this included a $500 surcharge applied to the employee's premium cost for the medical plan, a loss of health savings account contributions from Honeywell of up to $1,500, a $1,000 tobacco surcharge, and another $1,000 tobacco surcharge if the employee's spouse did not take part in the testing. So you can see how this all really adds up and is quite steep. So then under the American Disability Act, during this lawsuit, it was determined that companies cannot require employees to undergo medical examinations or respond to disability-related inquiries unless, again, they are job-related and consistent with business necessity. There are two exceptions, of course, again, voluntary, and there's also a safe harbor exception. And it was found that this violated the Genetic Information Non-Discrimination Act because the employees are penalized if their spouses do not complete the testing. All right, so this then resulted in the Equal Employment Opportunity Commission having some final rules. So information can only be received in aggregate form, and a number of things that they may not require the employee to agree to, as listed here. Of course, the sale, exchange, transfer, disclosure of their medical information, to waive confidentiality protections under the ADA in exchange for an incentive, or as a condition for participating in a wellness program. And again, except to the extent permitted by the ADA to carry out specific activities that are related to the wellness program. All right, so because of this, there were some recommendations that were put out in multiple media platforms. Companies were really encouraged not to ask employees to submit to medical exams or inquiries that were not job-related, really focus on that voluntary involvement. And then to err on the side of caution. So to offer rewards for participations instead of penalties, sometimes referred to carrots instead of sticks. So many of you can probably think to your wellness program or wellness programs you've heard about and think through, now you are starting to see rewards instead of some of the penalties like we just talked about. And there are a couple of items that are pending in Congress that can really help to increase these different wellness programs and their offerings. So we have the Personal Health Investment Act, which is currently pending in Congress. It's been pending for a number of years. I did a study back in 2013, 2014. It was pending back then. But this would allow the use of pre-tax medical accounts to pay for physical activity expenses. Another one that was also pending back a good 5 years ago, still pending today, is the WHIP Act. And it's currently part of a larger, more comprehensive wellness bill, which is the Healthy Lifestyles and Prevention America Act. And this would allow insurance companies to cover the cost for gym memberships that are outside of those gyms that some workplaces might have. So we do have some different things going on, some policy implications that would really be able to broaden those wellness offerings. All right, so some of the policy implications. So, and this also resulted in the Preserving Employee Wellness Programs Act. This was introduced in 2015. It reaffirmed the existing law to allow for employee wellness programs tied to a financial reward. It did clarify that an employee's spouse may participate in the program as well. It provides employees up to 180 days to request and complete an alternative wellness program. And then legislation does not limit the ECOC's authority to investigate and litigate any complaints of an employee discrimination. All right, so I wanted to take another little time out here, make sure everybody's staying awake. and ask, what do you find most surprising, troubling, or encouraging about these policy implications? And I think I need to learn how I get to these when I'm screen sharing. I think I saw maybe a little flash that means that there was a comment. Is there something in there?
There is a question. The question is, are there any mandates or requirements for companies to have wellness programs?
Not currently. Currently, that is, an encouragement. But, it's not, I think all of these different rulings really, made everything stick with the carrots versus sticks sort of thing. All right.
There's another question of earlier, you mentioned lawsuits. Are there any pending suits on the manufacturers for e-cigs or vaping?
That's an excellent point. I have not come across any, but that is another item that I will look into. And if I do find anything, I will post that in the comments as well. All right. I think we might have something, Q&A. All right, what is the purpose of mandating this type of participation in wellness programs? To reduce costs. That's an excellent question. So, if people are staying well, then the insurance costs to the company are greatly decreased. One of the main focuses has been diabetes. And we'll see here in a little bit that I did do a study that focused on prediabetes and the cost that can be saved from either delaying the onset of disease or avoiding it altogether really does save companies a lot of money. All right. Excellent questions. Thank you for your participation. All right, we will move on from there and now kind of shift gears to the current effectiveness of wellness programs. So we know, unfortunately, that compliance is poor. Just as many people will register for a wellness program as will drop out and not continue with it. People prefer programs that really focus on the risk factors. So like I was talking about, type 2 diabetes or maybe high blood pressure over just weight loss. Education and accurate tracking is very much needed. One example I have up here, I focus my research on physical activity. So we know that there is a response bias, and adults report that about 62% of us actually meet the physical activity recommendations, which is about 150 minutes of moderate or 75 minutes of vigorous activity per week. Although when trackers and other devices were used, it was found that only about 10% of adults met those recommendations. All right, so here is an example through some of the research that I've done. So I was looking at a company that had about 4,500 employees. And so here I'm just kind of showing an example of how much participation or compliance went on. So about 60% of those did participate in wellness screenings. These were biometric. They were offered by this employer. And it was something that they did receive a financial incentive for. I was looking out of this population that completed the screenings for those that were pre-diabetic. And so of those, about 13.8% or 372 qualified to participate in the program, which was free access to a hospital-based gym. And of those 372, only 40 volunteered to participate. And then of those, only about 15 were actually compliant in meeting the physical activity recommendations that were presented to them. So here to really look at that, only 2 participants out of all of these people that had the free access actually met those physical activity recommendations during the study. So there's some implications from this. One, we can start to look at some theoretical basis of wellness programs. So some of you might be familiar with the stages of change. There's 5 different stages. Pre-contemplation, where you don't recognize the need for change. Contemplation, where you're thinking about changing. Preparation, where you are planning, figuring out what to do, maybe which gym to go to make your change. Action, which is the adoption of new habits, and maybe the most difficult, maintenance, keeping those New Year's resolutions going. So then what we found within the program is that our participants really fell into these 2 different categories with 2 very different needs. Although what we were looking at were those that were at risk for diabetes. Many or most of those folks needed some different behavioral tools within the policies for the program to be effective, not just, kind of going back to the principle of if you build it, will they come? Well, apparently not a lot of the time. But we did have some self-regulators that did take advantage of the program, as I shared earlier. Continuing on with some theoretical basis that I thought might help some folks if you're considering doing any research in this area. You can also look at an ecological perspective, so looking at these 4 main different levels that people come in contact with when they're trying to make a change for their health. Whether, I keep talking about physical activity, but of course this could be, seeing their PCP on a regular basis or a stop smoking program. So public policy is the large macro level. So the Affordable Care Act would be a good example of this. The community or the institution. So this would be perhaps what your employer provides you, or different resources that are available within your community, like parks and trails that are safe for you to exercise on. There's this interpersonal level. Now, this includes a lot of, all of these levels can include culture, but, on here you see the food availability at home, so healthy options, the social support from your family, and then there's that interpersonal level, your own preferences and perceptions of what you need, cost is going to come into effect here, your social economic limitations as well. Which leads us into, I'm a business faculty, economic theory. So here we can start to, especially within that research I was doing, look at market failure here. So, and specifically under the category of public goods. So, in that gym membership, was the cost of keeping someone that is not paying that, keeping them from enjoying the benefits of the service because it's too prohibitive. Now, this is what we heard. This is what people said was the problem. But as I demonstrated, it didn't really turn out to be the barrier that was keeping folks from participating. All right. So now I want to shift gears into some of the research implications. So there's a couple of categories here of different measures. So we have improved health. And if you're doing a study, you might want to, or if you're part of an initiative to increase wellness at your company, look at short-term measures. So you can start to look at body composition, pain, blood glucose, blood pressure, some of those items that we talked about during those biometric screenings. But then if you're doing this on a long-term basis and have some year-to-year measures, you can look at disease prevention. Do those that participate in the programs that you offer have a less, occurrence of developing a disease like diabetes that we talked about? And even going longer, increase longevity. And then, of course, every company, probably everyone, is very interested in economic benefit. So we can measure this in reduced healthcare spend utilization, reduced sick days, increased productivity. Stephanie, that was something I should have mentioned earlier. A big incentive for companies to include this as well is to increase the productivity and also morale. All right. We can also use measures of behavioral impact. So participation, efficacy, perceived importance, the engagement of leadership, legal and political acceptability. So one example is to measure this through compliance with the U.S. Equal Employment Opportunity Commission rulings. And we can also look at the administrative measures. So how complex, how difficult might it be to implement the policy? What kind of record keeping do you need? Training, validation of measures? Is it something that's already developed so you already know that it's supposed to be effective? Do you even know how to measure it at all? All right. So now we're going to look through the lenses of our different folks that might be interested or generally are interested in these programs. So first here we have healthcare. So like I said, everyone is interested generally in some cost reduction in healthcare services, cost reduction in the need for pharmaceuticals that we've heard in the news. Several have increased in cost, patient satisfaction. There's some quality measures that are out there that have really shifted some focus on patient satisfaction. And then, of course, health outcomes. Now, looking at some of the barriers within healthcare, we have a century worth of reimbursement for treatment rather than for prevention. So, the setup for healthcare systems is really not to offer wellness, which makes this whole structural shift very challenging. The time for many hospitals who still have a pay-for-service model rather than value-based. Training. When I was doing my dissertation research, I will never forget there was a PCP that told me, we're just trying not to kill people, which really puts things in perspective. Many physicians really do understand and value wellness, but there's so much training they already have to undergo that they are focusing how to properly perform, a surgery or how to properly prescribe a medication. So there's just, the bandwidth there is very challenging. All right. So the landscape within healthcare. So, there's this focus on how to be able to focus on wellness and still meet the bottom line. This is just not the current structure, and currently hospitals are not quite sure how to make this shift. When you look at the different institutes out there, there's diabetes institutes, but, there are much fewer. There are some wellness institutes. Some just really do not believe it is their role. And some, actually, what we found from my dissertation was that many physicians just didn't believe that patients would take the time to engage in wellness, unfortunately. So they thought their time was better spent making sure patients received the pharmaceuticals that they would need. All right, so of course there's some opportunities. to focus on wellness results and cost savings, to attempt to do some restructuring, and maybe there can be a physical activity institute. There are some sleep institutes, some stress reduction, try and work on a cultural shift based on evidence. And, there's some argument out there about what is the responsibility once we have the sound research in place for these shifts to take place. And then, like we also talked about within the Commons, what are some of the community clinical linkages that we can take advantage of? Perhaps if there are resources within the community, rather than restructuring, maybe the better solution is to refer patients. But then there are challenges with, of course, how to share that patient data and really track it. Who's on the other end? There's not generally a person sitting at the trailhead of a park to make sure that a patient has engaged in the recommended amount of physical activity. All right, now shifting the lens to the employer. Of course, cost reduction, again, reduction in pharmaceuticals, employee satisfaction, and employee productivity. The barrier, this might not be the case as much, but those lawsuits were shown to really have employers shy away because, of course, no one wants to have to deal with all of that. The perceived time it would take administratively, as well as away from the workday for employees. Those challenges with behavior change, when we're talking about prevention, that's one of the most difficult things to do, is to understand how to work through the nuances of every single different employee's needs when it comes to how to change their behaviors, and how to come up with the most effective evidence-based incentives. All right, so we talked through a lot of this, so I'll move through it a little bit quicker. But the employees must volunteer. Sometimes there's a flexible schedule that is offered. Again, the behavior change, and there's really no gold standard for the best incentives. All right, so there's opportunities for the employer then to shift culture, increase flexibility, and to offer incentives and really keep track of how those incentives are increasing the participation. And of course, we need to move to the employee and student lens here. So what is the out-of-pocket expense? There may be some incentives to participate, but something that's often not talked about is, again, I focus on physical activity, is proper gear, the right shoes to be able to comfortably engage in a walking program. Those don't come cheap, and time, of course, is always a challenge. But health outcomes and then just general quality of life can be important measures and items to consider for the employee and student. And at the same time, the out-of-pocket expense and time are also barriers. Lack of awareness of the benefits of the different wellness programs, and lack of self-awareness even. Does each person understand what kind of, it might be a dietary sort of wellness program, or stop smoking. Again, it could be fitness. Do they prefer to exercise in groups? Is that a little bit intimidating? Do they need a private setting? Just really thinking through what is actually keeping them from making a change with that difficulty, again, in behavior change. All right. So the current landscape, as I said before, few take advantage. Everybody has a lack of time, and then our difficulty with behavior change. So The opportunity is to consider that time invested and how much productivity it can actually increase, whether it's just not getting sick because you're eating healthier, you're ensuring that you get more sleep, you're getting more physical activity, and how actually you can work more effectively during your work day. Some self-reflection through surveys to help understand your own personal barriers, just trying things out to help understand what might facilitate your participation more, and then improved quality of life. All right, so again, a little time out here, just to better understand what your perspectives are. If you're open to sharing, what is the measure, barrier, or facilitator that's the most important to you? See if I can.
While folks are typing their answers in, there are a couple questions for you.
All right.
Can health plans or employers offer reduced premiums if a person actively participates in physical activity and/or health styles?
I think this is, the short answer is maybe. It has to be determined that it's not a prohibitive amount. And, again, the shift has really been to offering the incentives. So employers can, yes, but they just have to be careful with those lawsuits we talked about in mind. All right. Are there any other questions in there?
There are. Let's see. Someone indicated, I'm currently researching diabetes self-management among elderly Hispanics or Latinos. Have you done any wellness compliance barriers among this group? I have seen language and cultural differences to be the larger issues.
Yes. So I am not an expert within that population, but generally speaking, I know that those culture implications are very important, as I'm sure you know. There are different definitions of what is considered healthy. A lot of cultures say that a home-cooked meal is healthy. Well, that home-cooked meal, while it may not have preservatives and different items like that, may be very high in fat and sugar. So those perceptions are a challenge. And also culturally, it may not be encouraged, or it just may not be sort of a regular behavior to engage in physical activity.
Great. There's another question of, do you think there needs to be a shift in public consciousness regarding wellness?
Yes. I might have my own personal bias there, but I think the amount of, especially in our American culture, there's a lot of other cultures that do focus on wellness more. And I think in any culture that doesn't focus on it as much, there's our cultures that focus on it even less. China would be an example with their extreme work days where their employees are often falling asleep on their public transit to just get to work. But, just thinking through, okay, are these hours spent, trying to crank things out really as productive as possible? Or if a small break was taken and allowed, whether it be to meditate or to take a walk, would that employee actually be able to work a bit faster and more effectively? All right. Any other questions in there?
No questions for now. A participant identified time as a barrier to wellness.
Yes, that definitely is a huge barrier, whether it comes to, being able to cook a healthy meal or get the sleep that you need. that's recommended, or physical activity. So a lot of the new physical activity recommendations just came out, and those actually focus on any activity as being good. It used to be, or helpful, I should say, it used to be that they really focused in on 10-minute increments, but this says any activity. So I know John Orlando actually posted in our comments about, every hour getting up, and I think you mentioned doing some squats. So there's been initiatives about that. Like maybe you just take a minute or even a few seconds throughout your day to try to work it in, since time is such a barrier. All right, and I think something else might have come through.
Yeah, there is a question. Have you seen any efforts by employers to offer more nutritious foods in their cafeterias?
Yes. So one example of this, I did some practicum work in my master's program at Cleveland Clinic, and there's some debate here, but Cleveland Clinic moved to only having diet drinks in all their vending machines, which some would say that's not a healthy option. But it's an effort. And Cleveland Clinic also required that their snacks and vending machines be only of a certain sugar or fat content as well. And then in their cafeterias, the offerings, the nutritional facts had to be displayed, and they had to make sure that there was a limit, again, on sugar and fat. That's just one example, but that is one I've seen. All right. Moving on from there, we are dwindling down on our time, so I'll move through some possible next steps for research. So sounds like some of you are conducting some wellness research, and some different ways to move through that is to explore the organizational employers' use and preferences and awareness of wellness benefits. So you might have aims that look to increase the use of wellness benefits, or maybe it might be perceptions that you're going to examine. The health outcomes due to wellness benefits, calculate the cost saved when wellness benefits are used, or potential cost savings through the benefits as well. All right, so one thing that is very important if you are conducting this research is to fully examine what is currently going on, and make sure that you are partnering with folks within that employer or insurance program, and understand and engage with those people that have worked very hard. This is, of course, no small task, and they've probably already done research. They've probably already examined many items. So the first thing is to understand what has already been done, what design is already being utilized, what measurements have they already decided are most important. And then to understand if they have any details or past research reports on how their current program is working. And then, of course, we have our literature reviews to do. So research what is currently going on, and the most up-to-date research on what is considered or what seems to be best practice. So what is that latest study saying is most beneficial and most productive? All right, so I've included some tasks here, of course. As many of you know, in the dissertation process, you are very familiar with these. So you're identifying your search terms, you're conducting and filtering your results and keeping track of these items, quality assessments, doing your data extraction, deriving your usable recommendations, and then, however the case may be, if it's for an employer, you're probably then going to write up a report. If it's in academia, write up a paper. All right, so next is engaging with those within the organization you're looking at. So what is more appealing or less appealing to the employees or students within the program? And what kind of support do these employees prefer or students prefer to better engage in their wellness programs? Going back to those items that were listed, is it the communication? Is it the better education and understanding of what's being offered? All right, so moving through some of your tasks. Of course, you're going to have to work with the IRB, both, if you're at NCU here and are a current student, within NCU, and if the organization has an IRB as well. Determine, of course, how many interviews or surveys or your demographic information. We talked about cultural shifts, so you definitely want to understand who is engaged or potentially could be engaged in the program. You're going to identify and recruit those participants, develop your interview guide, again, looking to the most recent research that's out there to best understand how to ask folks so that you get the data back that you're hoping for. And of course, to transcribe and do your data analysis. And here, something you might do then would be a pilot intervention. You might test the wellness program elements identified through talking with the employees to understand what is appealing or less appealing. You might divide your participants into groups. And then to better test the level of support desired, you might then test the identified facilitators and barriers, kind of like I did. We found that employees were saying, it's the cost. I just can't get to it because, that facility is not offered for free, and I really need to go there because, it had doctors kind of available just in case any emergencies happened, and they thought they needed that support. And we found out that wasn't the case. And then again, divide those participants into groups and just kind of walking through some of the tasks you might have, just a kind of regular, I would say, research processes, but of course, identify those measures you're going to use, the types of data you need to gather, and analyze, and how you're going to receive access to that, how you're going to receive access to health information, of course, due to HIPAA, and how you will then determine if the intervention is successful. So, if there's positive results, will you then refine the details and do a larger scale implementation? Or if not, what might you refine so that that program might be more effective? Here's just a sample timeline of how you might walk through these steps. And so this is a timeline I like to use. You can see I just made it up for as if we were starting today. So walking through that first research steps in the next couple of months, moving through the literature, and a few months after that, the interviews, and then the pilot intervention. All right. So then, of course, the implications from all of this are that we believe that from the literature that if there's an increased uptake of wellness programs, then compliance with different recommendations, whether it be physical activity, healthy eating, stop smoking, better sleep, reduce stress, that compliance will be increased, that we might be able to include this and include the value-based measures, and ultimately then reduce cost and improve health outcomes. All right, so with the couple minutes we have left, are there any other questions?
Thank you, Dr. Smock, for your presentation. No questions just yet in the chat box, but I'll let you know if anything comes up.
Okay, sounds great.
All right, it doesn't look like any questions are coming in, but anyone who was here for the presentation today, if you do come up with follow-up questions after we close out the meeting, feel free to post them in the comments and we can certainly continue this conversation. I know that Dr. Smock has already posted some elements or some questions before the presentation, so we'll certainly follow up there. And yes, someone just asked if the recording would be available afterwards, and yes, we will make that available to the NTU community. Wonderful. All right. Well, thank you again, Dr. Smock, for your great presentation. We appreciate your time, and thank you to all of those who attended today. And please join us again for a future SE Speaker Series presentation.
Yeah. Thank you so much for sharing your time today to everyone.
All right. Thanks, everyone. Have a good day.